Assalamualaikum and hi. The thing we have to know about thalassemia is factor or causes of thalassemia, example real case of thalassemia, sign and symptoms of thalassemia, and the last one is appropriate intervention or medication to treat the disease of thalassemia.
Thalassemia is driven by abnormalities in the DNA of cells that produce hemoglobin, which is a component in red blood cells where it transports oxygen around the body. The thalassemia mutations are handed down from inheritance. The hemoglobin molecule is composed of alpha and beta genes, which are susceptible to mutation. Alright, now what are the causes of thalassemia? This is the chart of thalassemia for a better understanding. First of all, the alpha thalassemia. The alpha hemoglobin chain is made up of 4 genes. Each of your parents gives you 2. Alpha thalassemia major. The indications and symptoms will be mild to severe due to 3 mutated genes. It's uncommon to inherit 4 faulty genes and it typically leads to fatality. The next column is alpha thalassemia minor. You will have no indications or symptoms of thalassemia if you inherit only 1 or 2 mutated genes. Your thalassemia signs and symptoms will be minimal. However, you are a carrier of the disease and can pass it to your children. 2 mutated genes pass is called alpha thalassemia trait. The other part is beta thalassemia. The beta hemoglobin chain is produced by 2 genes. Each of your parents gives you 1. You will have modest indication and symptoms if you inherit only 1 mutant gene. This illness is known as beta thalassemia minor. If it characterized by 2 defective genes, the condition is called beta thalassemia major, often known as coolie anemia. Babies born with 2 faulty beta hemoglobin genes are normally healthy at birth, but symptoms appear within the first 2 years of life. These are factors that increase your risk of thalassemia. The first one, family history of thalassemia. Thalassemia is passed from parents to children through mutated hemoglobin genes. The second one, certain ancestry. Thalassemia occurs most often in African Americans and people of Mediterranean, not to forget Southeast Asian descent.
The first case is about Jasmine Anis, 22 years old, that suffered from beta thalassemia. When she was 6 months old, she was initially misdiagnosed as having iron deficiency anemia, but eventually a hematologist, a doctor who are specialized in a blood disorder, came to the correct diagnosis of beta thalassemia. Apparently, she had inherited a blood disorder. This is a condition where the red blood cells of a person with a thalassemia cannot make enough of protein, which is called hemoglobin, that carries oxygen to the tissues and organs of the body. She has been treated by blood transfusion since her first diagnosis until now, whereby she has to receive this treatment in every 4 or 5 weeks as a routine. This is to maintain her healthy level of red blood cell. She will feel tired and weak without this regular blood transfusion. This is because her life depends on it. This life-saving red blood cells transfusion contain a lot of iron which can build up in the organ of her body. The cases is Aaron Cheng, who suffered from the beta thalassemia major since he was 1 year old. Every 3 weeks, he will receive a blood transfusion to survive as usual. And another part of his treatment is involve taking iron chelation medication to treat iron overload, which is result from the transfusion. But if left untreated, this excess iron could lead to the complications such as heart failure or liver cirrhosis, a condition where the liver is scarred and permanently damaged. So, 3 or 4 times in a week, he would have to inject a drug that called thalassemia into his body. This injection is placed under his skin that would last for about 8 hours each night. Now, instead of daily injections, he will take a new oral medicine that called syrup, which is he can take every night to enable a flexible schedule for him.
Okay, next is signs and symptoms of thalassemia. The symptoms of thalassemia depends on the genetic defects and its severity. The more severe the genetic defect, the less hemoglobin is produced and the more severe the anemia that results. Thalassemia minor is usually silent and usually cause no symptoms. If it does, the most common symptom is mild anemia. Thalassemia major usually have severe hemolytic anemia. What is symptoms of thalassemia? Symptoms of thalassemia are caused by a lack of oxygen in the bloodstreams. This occurs because the body doesn't make enough healthy red blood cell and hemoglobin. The severity of symptoms depend on the severity of the disorder. People who have alpha or beta thalassemia can have mild anemia, which can make you feel tired. People with beta thalassemia intermediate have mild to moderate anemia. They may also have other health problems, including bone problems, enlarged spleen, and slow growth and delayed puberty. People with hemoglobin H disease or beta thalassemia major have severe thalassemia. Symptoms occur within the first 2 years of life and include severe anemia and other serious health problems. Serial health problems including pale and leanness appearance, poor appetite, enlarged spleens, liver and heart, bone problems, children's, and the last one is dark urines.
All of us must have wondered what are the treatments of thalassemia, right? So let's check it out. Blood transfusion involves injecting red blood cells through the vein to restore normal levels of healthy RBCs and hemoglobin in a person's blood. But the needs of blood transfusion are vary with the severeness of the thalassemia. For example, people with beta thalassemia intermediate may need occasional transfusion during infections only. Meanwhile, beta thalassemia major need repeated transfusion every 2 to 4 weeks. There are also cases where more severe form of thalassemia needs to have more frequent blood transfusion to restore the levels of hemoglobin in their blood. Additional information, blood transfusion can cause a buildup of iron in their body over time that can be fatal to them. So, what could they do? The buildup of iron or iron overload can damage the heart, liver, and other organs. So, doctor will have patients with thalassemia undergo chelation therapy as this can help to remove excess iron from the body. Some people with thalassemia who doesn't have regular blood transfusion also can develop excess iron in their body. There are two types of medication given by this chelation therapy, which is oral and liquid medicine. Deferoxyrox and diferiprone are the example of oral medication, and patients need to take the pills once daily. But be informed that this medication could have side effects such as headache, nausea, vomiting, diarrhea, and joint pain. While the liquid medicine is known as deferoxamine that is given by needle slowly under the skin that could take some time and it can be mildly painful. It also has some side effects such as problems with vision and hearing. At the same time, doctors will also prescribe some nutritional supplements to people with thalassemia. These includes B vitamin, which are folic acid, and B12 vitamin. Folic acid is given to patients to help treat anemia and it can help blood cells to develop, while B12 vitamin is the key component to make healthy blood cells. Finally, the most effective treatment and the only treatment that can cure thalassemia is the stem cell transplant, or known as bone marrow transplant. This involves receiving infusions of stem cells from a compatible donor which have the same types of proteins, human leukocyte antigen HLA, on the surface of their cells as the recipient. Then approximately 1 month needed for the transplanted bone marrow cells to start making new and healthy blood cells. Be aware that this is a high-risk procedure and not recommended for those with mild and moderate thalassemia, and unfortunately, only small number of people who have severe thalassemia are able to find a good donor match.
That's all from us. Thank you.